you'll be able to hear a lot better than you do with the Facebook Live version of it. But if you have questions that you would like to ask the board or ask the agenda items that are on there, just go ahead and type your question into the comment section, and we have someone that's standing by with the camera that will relay that question to us so that we can get it answered. But again, I want to ask that you do your best to make sure that you keep your questions related strictly to the agenda item, which right now is the coronavirus update. So I will go ahead and flip this camera around and I'll hand it off and we'll get going. So, thank you. Okay, so are we good to go on the YouTube side? Okay. So one of the things we wanted to do today was, we talked about the public information officer at our last meeting earlier today. And the second portion of that meeting is to get just kind of an update. We want the public to be able to hear directly from our public health director what is going on in our county in regards to the coronavirus. There's been several things that we've been working on, several meetings that have been had by community leaders from the city, county, business leaders, people like that have worked really hard to kind of come up with our game plan. So with that, what I'd like to do now is I'll hand this over to Matt to kind of give a brief update of everything. We'll ask questions, and then what I'd ask is the public, if you have questions, type them in there, and then we have Andrew standing by. He'll relay that question to us. So Matt, you want to go ahead and take off and let us know what we got going on?
Members of the board, thank you for having me here today. We just finished up another meeting at the Emergency Operations Center over there where I gave an update on the current numbers for the state and both Iowa and Nebraska and our local numbers. It's important for everybody to remember right now, currently the state of Iowa is at 39 confirmed cases of the COVID-19. The state of Nebraska is at 29 cases of confirmed COVID-19, and locally here, Potawatomi County, we are holding at our 1 confirmed case of the COVID-19.
So it's not presumptive positive anymore?
It is still presumptive positive. It has not, presumptive positive, what we mean when we say that is that it has not been confirmed yet by the CDC.
Okay.
Obviously, with what is going on across the nation.
So those other numbers you gave have been confirmed by CDC, or are they presumptive positives?
They're presumptive positive until the CDC confirms it. I can't give you the breakdown of which ones the CDC has confirmed and which ones they have not.
Thank you.
The CDC is active currently right now in Nebraska because they have the biocontainment unit over there. So Sarpy, Cass, Douglas County have the ability to have direct contacts with it. We do not have that yet for Iowa. What I have been pushing is with our case that we have 1 case who's at home and self-quarantining. The methods that we have done so far with all of our community partners that started meeting early over this because we realized the threat potential that was coming into the community. We had meetings that started back initially in December through January into the planning phases of this. The steps that we've taken are working, and people in our area are abiding by kind of, the social distancing standards of it. And we are just continuing those meetings and meeting with the vulnerable population, people who work with those to continue what can we do for them, the supply efforts that we need down from the state, and working those efforts out through the community. I had Dr. Chris Elliott, who serves as our medical examiner for Potawatomi County. He came in, did a couple updates, was able to just kind of give the broad COVID-19 overview to the group and really help them with the definitions of the community spread and what that would mean. On our side, Nebraska had waited, and that's what you see in our news cycles, that we are I always call the KUTV news cycle versus the KCCI news cycle. And the KUTV news cycle, what we do is we monitor the metro area. We had partnered with Douglas, Sarpy, and Cass counties long before this, so we worked hand in hand with what they were doing. As their restrictions were starting to become tighter on those things, with the Iowa governor then released a proclamation that tightened us down before their second case of community spread happened. So our efforts had already been ongoing and in place to shut down the restaurant eating areas and gathering places such as movie theaters, gymnasiums, and those items. So I believe that as Potawatomi County, we're sitting in a good spot. The steps we took this morning is my department now is starting to gather resources from within the county. I asked to have Garfield Coleman, risk manager, and Jacob Head moved over into our department. We are setting up an emergency operations center for the public health side, and we're gonna have that up and running by the end of today. And we will be asking for support from our GIS department to allocate one person from there to us, and the IT department as well right now, to make sure that we have fillable forms ready to go online, our website content's kept up to date, and we're gonna be working a lot with mapping and the tracking of this. Iowa Department of Public Health yesterday, through their orders, turned down a lot of those responsibilities now to us. They are no longer going to be doing the contact tracing. They want that done at a local level. On the eastern side of the state, what you're seeing is a spread. And so I can't even speak to whether those departments are still contact tracing in their areas. With us at the level of what we are, one case, if we were to have 2, 3, 4, 5 more pop up, we're still able to be able to contact trace, find those sensitive areas that those people might have visited, put out warnings to self-monitor, self-quarantine, and so we will have that staff available, ready to go when that happens. We have contacts through other agencies, even on the Nebraska side, that we will be seeking out resources from to kind of come down and help us. Some of them will be paid resources, some of them won't be paid resources, but we are as prepared and ready as we can be. I think this is, it is going really well. Is there any questions on specifics that you may have?
I have just one question, I guess, is, could you possibly give us a preview of what we expect to come down the road? So like starting next week, you know, what kind of things, are you able to give that kind of information yet?
So
some of your planning processes maybe?
What we are, from some misconceptions a little bit is, you know, some of the things that we hear from the federal government, we're hearing them at the same time as what everybody else is hearing. So we try to move our efforts into those ways. We have identified and making plans for testing sites that would be outside, potentially drive through. So we're looking at sites that we could have traffic patterns that would not cause a lot of congestion, where we could kind of be easy in, easy out. We're trying to still local labs and area labs on which ones have the capacity to do the fast track testing that has been mentioned here lately. And one thing to kind of prepare a little bit for the public for, so you'll hear some talk of this out there, is the initial swing up that they discussed yesterday. As their labs efforts are able to go back and process this backlog on that rapid program, you should see what they say would be an initial swing up. And that is not necessarily new testing all of a sudden coming in, it is them processing the backlog that is there. So
I mean, those people could be like a week out. Like they could have tested those, say, 8, 9 days ago, and by the time that we get the results, and all of a sudden it looks like we got 30 cases out there. Well, these people are already halfway, if not all the way through the period at which they'd be getting better, right? Is that kind of
correct? And some of the things that we're hearing, I mean, you heard on the news last night, to where people are in some areas are getting tested, and within 48 hours they know their results. What we're hearing right now is from the medical health systems in our area, people get tested, and it's 8, 9 days if it goes to a private laboratory before we're even getting some results. So there is still some of that, the private labs trying to gear up and get ready to process these faster. The governor did say, you know, she had ordered that the Iowa State Hygienic Lab start that second shift, and to increase the capacity of the Iowa Hygienic Lab. The lab contacted us. We use them for processing of our STD, HIV samples that the public health nurses had been doing in those programs that we run. They suspended us sending those tests to them right now. They are still allowing us to send water samples for the water testing that we do, but everything else they're kind of circling back around and gearing up for the COVID-19 testing as well.
We have a question on Facebook. Does the county have tests that may be made available for those who need them?
The county itself currently does not have tests. We rely on the health systems that have tests, and the tests are available from the health systems. It's just they still are ordered to go through from the CDC to go through their screenings questions that they have. So you have to go through the screening portions for the health systems to be able to give the test.
When you say health systems, would that just be the two hospitals or other?
You have,
clinics?
in our area, we work with Methodist Health Systems, we work with CHI Health Systems, and we also work with our Community Health Center, which is All Care.
Okay, would that include the clinics out in the county? The other clinics?
Correct.
Correct.
They're part of that.
We have one
CHI.
private clinic that is up in the city of Underwood.
Okay.
I know, I'm sure there may be questions kind of tailored to this, but what kind of things do you envision other next steps for us as a county, working with the UOC, working with, where do you see this going next? Do you see us starting with testing, come next week or two, and then from there, we get more restrictive with what we're doing in the public? Or do you see it, the measures we've taken in place, are they gonna help kind of level this off, you think? What kind of, maybe just give a snapshot of what our next steps are, or what you perceive to be next.
So we do, the way I see the vision forward is we really have two ways to go. One is the measures that are put in place right now work, and we really kind of see that line flatten out, and hopefully at the end of the proclamation from the governor, we start to see a bit of a return to normal. The second period of it is that the methods don't work, and that people still do get together and potentially enter into one of our high-risk areas. And at that point in time, then the state would have the authority to either extend the proclamation that the governor already issued, and or even see a little bit tighter restrictions placed onto that. But I really feel like with the community members that we have and the methods that are put in place, we have really the full use of UNMC over there, which is a great asset to our metro area. When we look at this, I think of it as a metro area and the assets that we have as a metro area. Douglas County, Sarpy, Cass County, UNMC, Creighton University, all of us working together, Methodist Health Systems, we have been in these planning phases for years before this came up, and you're just seeing those things step into place now. I think we are in a better position than what you see across other areas.
Okay. Does anyone else have any questions for Matt at all, or?
Well, the only question, and I don't know that you can answer it, Matt, because it's so fluid, but so the presumptive positive is probably, I don't know, what is it, 9 days now on that, self-quarantined?
Yeah, we're coming up around, I believe, I'll take like the
So-
23rd of March.
Okay, so on that date, then is the presumptive positive released, or what's the step after that? If they have no more symptoms or whatever, they're back into the normal.
So the Iowa Department of Public Health is releasing guidelines for kind of what is your return to normal.
Okay,
And I can forward you those guidelines. They're available on their website as well for the COVID-19.
okay, but that's what they've given to her to tell her what.
Right now, I believe they're recommending, 72 hours after your symptoms have all subsided before it would be any kind of return.
Okay,
Instead of normally you get sick, they tell you 24 hours after your fever breaks, usually you're good to go. On this one, right now, what the Iowa Department of Public Health has put out is 72 hours. But it is available on their website, and I can get that information.
but she's gotta wait, she got to quarantine for the 14 days first, or not?
Correct.
Yeah.
She is at home self-quarantining and checking in with public health,
Right.
public health staff 2 times a day with temperature and symptoms.
Okay.
And we'll continue that for as long as we can, even if other cases pop up, not just the original one that we have, for as long as we have the capacity to, each person that we were to get a presumptive positive, we will do the contact tracing and we will do the monitoring, which is a twice a day call-in with symptom checks. And we're working on potentially getting an online tool set up that would allow them to punch in online, and then we will still make contact just to make sure that they have that person-to-person relationship built with the public health staff.
Okay, thank you.
Great. Is there any other questions from social media at all? Okay.
I have a question. Will those people that are on social media, will they be able to repost this presentation on their Facebook?
Yeah, they'll be able to share it.
They'll be able to share it? Okay.
Yep. Yep, though my page is public, so they'll be able to share it as many times as they want.
Okay,
One thing we can add a little bit to is there are concerns, and it's in the news media right now, is about the PPE shortages that are being faced by all health systems and, some of the different steps that they are taking to extend the PPE that they have. We do already have orders in now to our state resource center that will then, be able to, and we can't say that we'll get it all, maybe we'll get all we ask for, maybe we'll get more, maybe we'll get a little bit less than what we asked for, but whatever resources the states get, it will allocate it down to us. Those supply chains have already been put in place and have been rehearsed several times, so we're ready for those supplies to come into our community when the state gets them there and ships them out to us, and we'll be able to disperse those out to the agencies that need them.
PPE is.
Personal protective equipment.
Okay.
I guess, is there anything else, Matt, that you wanted to say before we wrap up, or you think?
I appreciate all the support that you've given me so far as we work our way through this. It's obviously unprecedented. It's never, has not happened in any of the time since we have been in place. We are, obviously a new health department, but I want to let not only you know, but the public know as well. We're new as far as establishment. Our staff experience is very vast when it comes to these public health matters. I really feel like we are in good hands, and with health systems offering as many resources as they have, even though they're making their own plans, our other partners across the river in Douglas, Sarpy, and Cass counties, working with us, we're in a good spot.
Okay, great. I guess with that, as long as there's no other questions that come up here in the next few minutes, Matt, just from the board's perspective, you're doing an outstanding job, and we really appreciate everything that you've done with taking measures with this virus. I mean, it's like you said, it's an unprecedented ordeal, and we're doing the best we can to get through it. What I'd like to just say, also is that the city has been phenomenal at teaming up with the county on this and working with us to try to get through this. And I think that's really important, given that about 65–70% of the population is within the Council Bluffs area. That's not to say, though, that we're not eyeballing the other smaller communities and making sure that they have the assets and resources that they need too. So this is a countywide deal, but on the reality of it is that we're looking at this more in a regional sense and area sense, where we're part of this metro area and we're taking care of all the issues, all throughout our county. And again, whatever we can do from the board side of this to help you accomplish the mission that you need to do, let us know, and we'll make sure it happens. So with that, I'd entertain a motion to adjourn.
So moved.
Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Okay, motion carried. Thanks everyone for coming, appreciate it.
Sure you